is Jim Purcell.
And I'm Stephen Van Yoder. We're the co-founders of the Returns On Wellbeing Institute and co-hosts of today's interview with Carol Black, known respectfully in the UK as Dame Carol Black, the equivalent of knighthood for women who've achieved excellence in their chosen fields.
Dame Carol is a top governmental advisor on health and work in the UK. She studied medicine at the University of Bristol and practiced as a physician after graduating in 1970. Over the years, she's become a leading voice on mental health issues in the workplace and has had substantial influence on public health policies and practices in the UK. In 2006, UK Prime Minister Tony Blair made Dame Carol the National Director for Health and Work. At the request of the UK government, she's issued a series of reports on health in the workplace. Dame Carol has served as a leading rheumatologist and as a medical director of a large London teaching hospital. She recently stepped down as the president of Newnham College in Cambridge, and she's the chair of the British Library.
And today we will focus on Dame Carol's work on mental health in the workplace, drawing on her experiences in the UK as chair of the board at Think Ahead, a training program for mental health social workers, and her work on several mental health research studies. So, Carol, thank you very much. We're pleased to have you on our podcast.
Delighted to be here.
You have a very broad professional background. Tell us a bit about your journey from being a practicing physician in England, some time ago to where you are today, advising the highest levels of the UK government on all things health, but increasingly, I think, workplace mental health.
The change really came about when I became president of the Royal College of Physicians. That was 2002. And that was my first interaction with government. And I learned that you had to do things differently. It wasn't like being a medical practitioner. You had to be really prepared to go to them, yes, with problems, but you had to go with solutions. I learned how to really interact well with the chief medical officer, the advisors to the prime minister. And that really interested me in a broader cast of possibilities than medicine itself. At that point, I became interested in occupational medicine because it was a faculty of the college. And it was through that interest that I became aware of the possibility of becoming the National Director for Health and Work. I'm not an occupational physician, and I didn't know much at all about business, but I decided to apply, and they appointed me. And that was really a light bulb moment. I began to realize that the determinants of our health were not just the diseases we acquired, but were you employed or unemployed? Had you had a good education? Did you live in an area of poverty where there was very poor transport? And I became really interested in the value of good work and how you enable people who were either out of work or about to fall out of work really stay in work. And in my first report for government, I really centered part of it on the importance of mental health. So that, very briefly, Steve, is sort of a very concentrated way of approaching what has happened to me. And I've become passionately interested in that relationship between health and well-being and being in good work. And I do think work has to be good work, not any old work.
All right. In my research, the UK seems to take mental health seriously. I see a lot of discussions around mental health in general and in the workplace. Your Office of National Statistics, for example, issues annual reports on the mental health and well-being of the entire population, and your CIPD issues annual reports on health and well-being at work. And you yourself advocate for more active roles by employers regarding employee mental health. This implies to me that the UK is really focusing on the core causes of mental illness, even more so than the US. As a former CEO of a US health insurer, I not only believe, but I know, while we spend huge sums after mental illness has already become a seriously comorbid condition, we don't spend nearly enough on prevention and early intervention. So what do you think the UK is doing right, and what do you think the US might learn from it?
The first company I became aware of as really taking mental health seriously was BT. And as early as about 2004, they were developing a program, and it came from the bottom up. It wasn't imposed from the top down. It came through their workers of thinking about how do you promote positive mental health. So not thinking only about what do you do when somebody's sick, but what do you do to keep them healthy and well in a mental sense as well as a physical sense. And I would say they were really way out in front. And I think it took a few more years for other big companies to start to understand that mental health was crucial to productivity. And in my 2008 report, I looked at that and said, you really got to start to get this right. You've got to acknowledge that mental health is there. We've all got mental health. It's good to talk about it and to try and destigmatize it somewhat. I think employers began to realize that if they had a workforce that had good mental health, had a good sense of well-being, were pleased to be in the workplace, then their productivity would be much greater. And the sorts of things that enabled it to grow were when CEOs or senior executives in some of our very big companies talked about their own mental health. And that was sort of lifting the lid off this problem. So if you as a CEO could acknowledge that you'd had a time when you were really stressed or maybe depressed and you'd come through it, and it was all right to talk about it. But really what they needed to do was think about the essential enablers of good mental health in the workplace, which is developing the right culture. And it gradually became much more common to see the leaders owning it, and then the boards or councils of organizations saying we want reported to us the health and well-being of our workforce, and we want to know about mental health. And then, which has been slower to get going, but now is so much better in the UK, is enabling line managers.
In the UK, employers don't have health insurance coverage costs because your national health plan provides it for free. So if UK employers are not trying to reduce this, what are some of the benefits that you see that would cause them to still be concerned with mental well-being at work?
Well, I think they've begun to see that a healthy worker, physically and mentally, is a more productive worker. And I think that as they've started to see that, they understand that health is related to your capacity to be in work and do a good job. And we borrowed from, I think probably from America, the term presenteeism, as opposed to being absent. And many more companies now are measuring presenteeism. And what they're finding is the commonest cause of people being at work and not able to work to their best ability is actually, in fact, mental health. And so they do see that, one, there is an economic benefit, there is a productivity benefit. It's also something to do more with our younger generation of workers, that this has a branding effect. You know, young people want to work for companies that care about their health and well-being. So it's got that additional, we have a good program, we do care about your health and well-being, come work for us, don't go and work for our competitors.
What are you advocating that UK employers do regarding employee mental health, and are they listening to you?
They have got to think about the essentials. You know, what is the leadership team doing in this respect? Are they really giving out the right messages? Does it feel the right place to work? We've seen, in particularly actually in our National Health Service, where quite a few hospitals have non-exec members of their board who take on the role of being the interested board member in the health and well-being of the staff. And they present with the HR director or another suitable person to the board, probably biannually, on that health and well-being. And there's been a particular emphasis on mental health in more recent years. And then I try very hard to say, if you don't get your line managers competent in this area, it's hopeless. You know, you can put in all the nice fancy programs of interventions, but if you haven't got that soil right, if the culture isn't right, you can't do it. Well, you can do it for a little while, but I try to talk to them about embedding it in the very fabric of their business or their workplace, rather than an add-on. To start with, I think at home, quite a few companies thought health and well-being, in the sense that we're talking about it, was something you added on rather than you embedded as a necessary thing. And I think that's been a journey that quite a few companies have been on. It's not something you can cut off when times get bad, because it is in fact essential to your productivity.
Do you think it's catching on in the UK among workforces that people have to feel comfortable understanding that mental health challenges are real? It's okay to talk about them, and there won't be any repercussions or negative impact on you in the workplace for doing so. And then how do you make sure that that's understood widely?
I think two things have happened, but I think one is something that's happened in general. We never used to really resource mental health well in the NHS. You know, it was the poor cousin to physical health. And that has changed over the last few years. And it's really changed in the most recent years. And again, it was helped certainly by Theresa May, who really was concerned about giving mental health parity with physical health. So I think there was acknowledgement by the government that they couldn't hide mental health away anymore. And that, I think, of course, helped in general, because it got more funding, it became more talked about, and it became more accepted. So I think that then spilt over somewhat into our workplaces. I think then it was this, as I say, it really required the top of the house to give out the very firm message: you can talk about your mental health, that they had events that enabled people in safe spaces to talk about mental health issues. And so I almost think, although I'd hate to say it, that the pandemic has enabled this topic to be talked about more.
At the Returns on Wellbeing Institute, we've increasingly focused on employee mental well-being as the most important factor determining overall well-being, because it affects so many outcomes, including our physical health. How do you believe mental well-being should be prioritized in the total picture when you have a balance of things to be involved with?
Oh, Jim, what a difficult question, because I think they're so interrelated. Certainly there should be parity. So, you know, we originally at home had, you know,
Sure.
physical health up here and mental health down there. I mean, for example, my ability to exercise affects my mental health. I find that things are so interrelated and that we can't easily separate them. But I believe if you're in poor mental health,
Exactly.
it is very difficult to look after your physical health. You know, where is the motivation? Where is the energy to do that? And I think there is a much greater recognition of that now at home. And so I think we are seeing, we're certainly seeing parity established much more in many places. But mental health is such a powerful factor, either for good or for evil. So I think we're getting a much better understanding of where mental health fits into the whole healthcare scenario.
I know you mentioned perhaps one of the odd good things about COVID, but how in the UK are workplaces being impacted by COVID from what you've observed?
What is happening, we see more people reporting themselves to be depressed, and more people who are really anxious about returning to the workplace, because we've had this scheme of the government paying for people to be at home. They've paid for them. They're not in the workplace because they can't. The jobs they do, they couldn't go to the workplace to do them, and we're seeing a whole lot of additional problems of people not only anxious about COVID and returning to a workplace, but just feeling very deconditioned and anxious about whether they can do the job that they used to do. I mean, they've been out of the workplace for maybe 8 months, so it's an almost foreign place to them. Will it still be the same place? Will the same people be there? What will it be like? Do they have to use public transport to get there? I'm really worried by the level of fear that we see in our working population about returning to work. There's great anxiety about their financial security because a lot of people took reduced hours, so they saw a drop in their income. Interestingly, a lot of people saying their physical health has suffered too, and that makes one wonder about that connection between both their mental health going down and their physical health. And our Office for National Statistics has reported that our national levels of well-being are the lowest they've ever recorded since they started to take records.
There has been sort of growing talk and recognition in the U.S. of what are being called adverse childhood experiences, and that depending on the kind of childhood you had, and they have whole scales for the sorts of things you could go through, it affects the kind of adult outlook you have on life. And another dimension to what you were just speaking about, when generations of people go through something at the same time. There are a lot of people born in the 60s, had their childhood in the 70s. There was a divorce explosion in the United States. And there are a lot of people in this age group that have known a lot of disappointment in life. And then when the economy doesn't treat them well for a long time, they fall into depression, and it's very stubborn. And I would say that probably a lot of millennials, the younger people that were having a lot of challenges before COVID, financially and otherwise, now this comes on top of that. You can start feeling by the time you're 30, this is permanent. And it shapes your outlook, the way you frame difficulties, challenges, ability to bounce back. But what do you think? Where does this go too far to what an employer should be thinking about versus a therapist? But it's a big situation. It's like it could even be PTSD on a large scale in some cases in the workforce.
Just in the writings that are coming out from some of our institutions at the moment, that they're really focusing and saying, what is it going to be like for these people in the next 10 to 20 years of their life? How much are they going to have lost? How much damage has there been? And what is it that we can do now to mitigate that? I mean, we can't put it back to what it was like before this happened, but are there things in terms of either educational needs, skills needs, a really supportive workplace, understanding that there is this problem, so perhaps a little bit more flexibility, but to first of all acknowledge it. And so we understand that it is there and a possibility. And then what sort of things do we have to do?
Deloitte report this year noted that in 2018, poor mental health costs UK employers more than £43 billion, up 16% from 2 years prior. And a lot of this is job-related stress due to things like poor managers, financial stress, impossible demands. What are you advising your UK employers to do specifically to reduce the stress issue, which seems to be so important?
Well, I think first of all to recognise that it's there, and if possible, to quantify it, because I don't know about in the US, the type of statistics and data that is collected at home varies very much from company to company. And I really try and advise them to be as granular as possible, so that they do know the level of stress, of depression, of anxiety, of financial concern. You really can map what it is in your particular workforce that you need to pay attention to. Otherwise, they tend to sort of throw the bucket at it and hope that one of the interventions something will happen that is good, but rather that they really understand their workforce and then think about the interventions that are good practice, because quite frankly, we don't have hardcore scientific evidence to say what we should do. I mean, we really don't have that. And to combine that with all the good things we've talked about line manager capability and training and support. So I think mental health is so related, stress is so related to the way you are treated in the workplace, Jim. And at least you can reduce a lot of that. You can't reduce it all, but do you really listen to the worker? Do you give them the flexibility that you can, and you understand they might have caring needs again, for example? So it's really all about people management and understanding human beings to be able to sort of reduce that level of stress. And of course, we do have some workplaces that have far too much bullying and harassment, and really dealing adequately with that. And I also think in knowing your data, to know what the different demographics are for your sort of middle-aged workers and your older workers, because the things that might be stressing them might be different.
I believe you mentioned leaders have to know their numbers. What did you mean by that?
Well, I think they've got to know within their workforce, what does that workforce look like in terms of the health, mental and physical profile? I would add so what percentage of their workforce would report themselves as being depressed or anxious or stressed, having financial concerns, so that they know where they've got challenges, and they know to improve their productivity and reduce their absence. They've got these health-related issues, not all of which are amenable to change, but quite a few of them are amenable to change with the right leadership and the right interventions. But it's often so much easier to think, I've got some stress in the workplace, so I'll get my mindfulness and I'll get my mental health first aiders, and it'll all be well, and I've ticked my box, and then I can sort of go back to my office. It isn't like that. This is a living thing that you've got to keep your sort of hands on the tiller, and know what is going on. And I think good managers help you know that. I mean, a good manager ought to know when someone in their team is not themselves.
In the United States, the numbers before COVID were very bad. Somewhere pushing 50% of the U.S. workforce, the people making lower wages or not quite the median wage were struggling. The further down the scale you got, the worse they were struggling. And that seemed to run in tandem with stress, anxiety, mental health challenges. Now with COVID, it's only gotten worse. And we're seeing that financial stress is really the top challenge for most Americans, in the 70-something%, if I recall correctly. And I've seen studies about what unrelenting financial stress can do to the body. It can actually affect the mind. There's a study that said you can lose IQ points going through stress for sustained amounts of time. It affects your sleep. Clearly, it affects your attitude about life. And then it can lead to long-term depression. But what do you just in general, the connection between financial stress, mental health, and what are employers doing about that in the UK, or what should they be doing about it?
Well, I think first of all, they're recognizing that it is this very strong relationship that you say. And I think, again, it varies in what companies do. Some companies will merely signpost, they will make a real effort to say, look, this is where you can get real help. So they will signpost to outside organizations. I think in some companies, they've actually put in-house, schemes where they will help people consolidate their debts and they'll get them sort of sorted out and onto the right track. So I think, or there will be loans. So I think it's varied, but I think just the sheer relief of the recognition that you can say, I'm in trouble, I really need some help, and you will not be stigmatized for that. And there will be a positive attitude of, okay, this is a real problem. You're a valuable worker. So how are we going to get about helping you? And again, there would have been in some generations a real reluctance to admit any financial difficulty because it was just not what you did. But now I think people are much more willing. And we sadly still have quite a lot of people who, even though they're in work, they're in such low paid work that they really do live, quite frankly, below the poverty line.
Workers, especially younger, but they don't, this isn't entirely younger people, but definitely a disproportionate amount of them want to work for companies that stand for something beyond the bottom line, which to me falls under purpose, mission, and feeling part of a culture that is all moving towards something better, and they're part of it. But where do you think this fits with mental health? And not just that, what do you think employers could do to leverage this as an opportunity to build this into what their company is all about?
If you feel that what you are doing is contributing to society or to your neighbor's well-being, that for me is a purpose to get up. And I think that enables you to feel so much better about yourself. And that is related to your mental health. If you can give your employees sense that they are contributing to something bigger or they're making the teamwork better. I mean, there's a whole variety of things and levels which this will operate. I think it matters to young people. It really is damaging to your mental health, and it's a very strong correlation with depression. And one of the sad things about the pandemic, it must be true in the States, is that all the very good volunteering that many people were doing that did give them that sense of purpose, the older generation going out, the 50-year-olds plus, they couldn't do it because, they weren't permitted to do it. And that has left them much more lonely and depressed. So I don't think purpose has to be a huge, big thing you're trying to do, but it has to be relevant to your place, where you are in your life.
I think you've made some points that U.S. employers really should listen to, and hopefully our HR audience can use them to persuade their CEOs to look at mental health and well-being in a more strategic way. But thank you very much for joining us.